Before I start, I just want to start by acknowledging the traditional owners of the land on which we meet today and acknowledge the elders past and present. And I also want to thank the organisers and yourselves for inviting me to this keynote speak on what the agency is up to in the area of digital health. I might start with just a quote from Tim Kelsey, who's the CEO of the agency. And he recently stated that the digitisation of health is the most important social imperative of our time. It will lead to bringing together the best health care for consumers. It will provide better and more productive processes for industry and providers, and it will bring improved economic outcomes for Australia. Kind of encapsulates really an important element of really where digital health is focused and what it wants to enable us to achieve. So I think he's right on the mark, and more importantly, I know that we all will have an important role to make this a reality over the next few years. Now, I've only got a little bit of time today, and to cover off on some of the key programs the agency is involved with, including a bit of a focus on stuff in general practice, such as the shared health summary and data quality. Now, for those who attended the workshop just half an hour to an hour ago, I do apologise in advance because some of this will be repetition, but it's reinforcing activity otherwise. If I can have the first slide, I'll do that myself. Australia is renowned as a country of innovation. Back in my time was things like refrigeration, the black box flight recorder, but in the more recent times, the Wi-Fi, cochlear implants, pacemakers, ultrasounds. People are sometimes shocked to think that these are things that were invented here in Australia. And as a nation, I think we should continue to be a nation of innovation, especially if we're to remain effective on the global stage. With regards to our health system, this graph from the Commonwealth Fund, and only a year ago, clearly shows that Australia is certainly a high-performing health system. You may beg to differ otherwise in some aspects, but compared to other OECD countries, we are a high-performing as well as low spending. So we're one of the best countries in the world at the moment to be having to have your health care. Having said that, obviously this doesn't necessarily capture the variation in care, and as you know, the care that Indigenous populations receive compared to those in well-to-do urban areas is quite far apart. But nonetheless, overall, we are doing reasonably well. So the agency was set up, we're getting on to nearly 2 years ago. It was initially the National eHealth Transition Authority, which took a lot of the work in building up the digital health infrastructure and components, and then 2 years ago it was transformed into the Australian Digital Health Agency. And some of the key things the agency is involved with really is to ensure that consumers are at the centre of control for their health and healthcare and the information about their health. And it's about connecting and empowering healthcare professionals. And finally, it's about promoting also the leadership, that innovation I spoke about earlier in digital health. So prior to the development of National Digital Health Strategy, and that's by the Department of Health, the agency was heavily involved in putting that strategy together. Some of the key themes that came from all the stakeholder engagement meetings and events, as well as people that were able to make submissions. Some of the key things that came out of that, particularly from a consumer perspective, one was support me in making the right healthcare choices and provide me with more options and information. Help all the people who care for me to understand me and together provide a safe and personalised care. Or create an environment where my healthcare providers and I can use and benefit from innovative technologies. And finally, an important point around preserving trust in the healthcare system and protecting privacy and the patient's rights. So some of the key elements of the national strategy are, one is that health information is available whenever and wherever it is needed. And the My Health Record is a key component of that. objective. Health information should be able to exchange securely. That involves not just exchanging information in a secure way, but in a way that people can understand what that information is. In other words, what I call semantic interoperability. We're all connected, we can exchange information, and we can understand what that information means. Very important to ensure high quality data is generated and shared amongst the providers, and also better availability and access to prescriptions and medicines information. In fact, as I haven't got a slide here, but something like 10 to 15% of people admitted to hospitals are because of medication errors and costing billions of dollars. And part of this is strategy is to try and mitigate and reduce that. We're also looking at digitally enabled models of care. The healthcare home is one example of that, and how we can, whatever it is that we do. I believe that it's all about the processes of care that we put in place, and the digital is about enabling those processes rather than the other way around. Training a workforce to be, and that's starting from universities, medical school, maybe even in high school, about understanding health information, health literacy, and being able to use digital technologies in exchanging and using that information confidently. And finally, about developing that innovation again. The same theme I started about earlier. I think there's no reason why Australia can't be at the leading edge of developing the latest digital health technologies for better health care. So how does the My Health Record work? Essentially, a consumer or patient will interact with a range of providers at the next level there. You can see GPs, hospitals, specialists, etc. And each of those providers can generate specific documents that they usually curate and produce. GP in particular around a shared health summary, a hospital around a discharge summary, for example. Specialists will usually produce a specialist letter. All of these things, including pathology, x-rays, and pharmacy dispense information, will go into the patient's My Health Record and made available to all other providers in the healthcare system that are involved in the care of that patient. Very important. This is not information available to anybody, anytime, anywhere. It's only those involved in the care of that patient, including the patient themselves, obviously. Just an update on where we're at. At the moment, we're approaching 6 million consumers that are registered with a My Health Record. Pretty well, majority of GP practices are registered. Most of the public hospital systems are connected. And as you can see, I'm not going to go through every little detail there, but shared health summaries, we're approaching, that's already several weeks out of date, but nearly 1.7 million shared health summaries, 1.8 million discharge summaries. And prescription and dispense documents are going to be escalating quite rapidly soon. We're expecting up to 80% of pharmacies to be connected and uploading dispense records of medications by the end of June next year. So as you can see, there's already a significant amount of information already available on the My Health Record. With regards to data quality, I just want to highlight a couple of things, and I'm going to use a shared health summary because we're predominantly people here probably involved in general practice. The important thing about data quality is it's not necessarily means you've got to dig up every little thing that's ever happened to this person in their whole past life, but what is key relevant information from this point going forward. And some of it might be past information. If they've had a cholecystectomy, for example, gallbladder out, it's good to know in case you think they're having gallstones again. The important thing is it's a whole of practice role to keep this data accurate. So your frontline practice managers, receptionists will keep demographic data about the patient as accurate as possible. Your GP will ideally curate a list of current medications the patient is taking and a list of diagnoses that are relevant, including allergies and immunisations. And in practice, nurses in general practice often are the ones that upload the immunisation information, for example, and have a role in looking at all that information at the time they're providing say a chronic disease management plan or health assessment. It's a good time to talk through the patient and just cleaning up that data. Some of it might need to go back to the GP to authorise and authenticate that, but the key message I want is a team approach within general practice. Now, just to let you know, we're obviously one of the we are the first country of its size to provide citizens with a summary of information. As I said, we're nearly approaching 6 million, and soon there'll be an announcement that every Australian will have the opportunity to have a My Health record in an opt-out approach. At the moment, you have to opt in. I'm not sure when that announcement is going to happen, but it's soon, and whatever soon means, it could be weeks, it could be a month, but it's going to happen before the end of the year. And the key thing there is that all of this is about allowing consumers who want to have access to their health information, that information available to them in a 24/7 environment, and they can share that with any healthcare provider they come in contact with. And one way they can do that is by having an app on your phone. I've got the Health Eye app on mine. You just use your MyGov. People are aware of MyGov. MyGov is where you can do your transactions around taxation, Medicare, Centrelink, etc. You can go onto MyGov now and actually create a My Health record for yourself. As I said, that will be created for you. But once it's created and activated, you can use one of these apps to connect through MyGov, which authenticates you. You then carry access using a 4-digit PIN or face recognition, as I've got on my phone, to your health record, everything. And you can take it anywhere in Australia, and in fact anywhere overseas, and you can show that to a provider who doesn't have access at the moment to your record. Just really what we're doing is moving from our current system, which is still, despite being one of the best health performing nations in the world in healthcare delivery, there is still areas for improvement. Things like having a person having a pregnancy will need to have 15, 20 different encounters with different aspects of the health service, and no one necessarily knowing what's going on with their care. And through the My Health record, there will be at least one integrated platform for that information. We talked about particularly accessing tools in remote and rural areas. This allows that at least availability. And it's beyond just the My Health record here. We're talking about telehealth, telemedicine, and virtual care. In the US at the moment, nearly 50% of consultations are virtual. And the only reason it's not here is because Medicare says you must have a face-to-face interaction to access an MBS item number. Look, the rest of the information is about using medicines information and avoiding some of that 10% of admissions that are due to medication errors. And a lot of pathology and x-rays are often duplicated. In fact, it's somewhere between 14 and 20% depending on the type of test. And think of radiation as a good example. If someone's had more than 3 CT scans, you're already increasing your risk of cancer. So knowing how many CT scans someone has had, you may think about doing something different or not doing that test if it's not necessary. So I just want to round up with the key benefits of having a My Health record. We talked about avoiding adverse drug reactions. We talked about enhancing patient self-management and engagement, improved outcomes, reduced time gathering information. Certainly if a new patient has come to your practice or comes to an ED, having all that information available before you see the patient will help a lot in terms of understanding what the patient past history is and what their current needs may be, and avoiding duplication of services. The last bit in the middle there at the top, improve systems through secondary use of data. About 30 or 40 minutes ago, the Minister for Health, the Honourable Greg Hunt, just announced a framework for the secondary use of data in the context of My Health record. And what that essentially will be, well, it won't happen until about 2020, but essentially it's for consumers, you would need to opt in, participate. You need to action that you want to participate and share your data for research or planning or anything else like that. So that's just fresh news just about half an hour ago. My time's almost up. I'm certainly happy to answer any questions or if you want more information, we have a booth in the exhibition. We'll be there later this afternoon and certainly all day tomorrow, and look forward to seeing you there if you need any more information. Thank you. you. Thank you, Jean. Cheers.
Thank you.